Dr. Supratik Bhattacharyya. I'm a consultant endocrinologist based in Kolkata. And thank you, Dr. Bansi Sabu and team RSSDI for this invitation. So today I'm going to talk about the residual risk odyssey from LDL to lipoprotein A. Now, we have known that atherosclerotic cardiovascular disease remains one of the leading causes of death. And obviously, we know about the traditional risk factors for atherosclerotic cardiovascular disease. And one of the leading or traditional risk factors would be elevated LDL cholesterol levels. And since the time statins has been discovered and there has been extensive statinization, I think it has completely revolutionized the management of atherosclerotic cardiovascular disease. So LDL cholesterol-centric approach with statins has served the foundation for primary as well as secondary prevention and led to significant improvements in the cardiovascular outcomes. Now, the question remains, is that going to be enough? Because we've come to know that in spite of treating the LDL cholesterol to the target levels that we desire with statins, there still is a residual cardiovascular risk, which is hitherto not been taken care of as of now. And this residual cardiovascular risk could be because of residual inflammatory risk, residual metabolic risk, or even residual thrombotic risk, and mainly accounted to a molecule called lipoprotein A. We'll talk about the structure of the lipoprotein A during our talk in details, and about the mechanism, how it might cause, increase in the inflammation, thrombosis, and finally plaque destabilization. And we'll talk about another very important molecule that may be associated as well. We have also known that if we are targeting the lipoprotein A in those cohort of patients where it's very high, then we know that we can decrease the risk of cardiovascular events by almost 42%. And this has been seen across the study, whether we're talking about Interheart study, ITER study, it's been the same. So Odyssey outcome trial, which remains the focus of today's talk, we've seen that a higher lipoprotein A levels led to a higher cardiovascular event risk, and over and beyond targeting the LDL cholesterol, we probably need to address this lipoprotein A. And we have known that each 5 milligram per deciliter reduction of lipoprotein A predicted a 2.5% relative reduction in the cardiovascular events. So to understand more about this, please do join us for our talk today. And hopefully you are going to learn a few things which we do not frequently talk about while we talk about the statins in general. So thank you for joining us.